Right. Welcome back, everybody, to the brain injury discussion. This is your host, Jay. Today, we are going to talk about lesser known acquired brain injuries. When we think of brain injury, we think of that blow to the head, or we think about that stroke, or maybe we're thinking about that cardiovascular event. Maybe we're thinking about that cerebrovascular event, or maybe we're thinking of maybe that car accident. This video is going to hopefully expand our minds a little bit to talk about some of those lesser known brain injuries. Like always, sources will be in the description below. We always encourage people to look those up. There's a lot of interesting ones here. And also, we'd appreciate feedback in the form of a like, a comment, or a subscription to the channel. We try to put out this information weekly and we try to keep it informative, educational, but also very applicable. So, with that being said, let's get started. Let's find out what are some lesser known brain injuries. But first, we need to talk about the definition of brain injury. The definition is stated as an injury to the brain that is not hereditary, congenital, degenerative, or induced by birth trauma. That's not a brain injury. However, what we're looking at might be construed as a degenerative disease or hereditary or congenital. Again, there might be some area there where this proves, maybe it is a brain injury and not one of these four things. And that's something we need to keep into our minds that yes, we got to keep these four things: hereditary, congenital, degenerative, induced by birth trauma. We need to keep those in our minds as not brain injuries. But that's the technical definition provided by the Brain Injury Association of America. So, with that being said, let's get started into encephalitis. Encephalitis, obviously, I've talked about mosquito-borne encephalitis, but they're usually viral encephalitis. I've talked about Eastern equine, St. Louis encephalitis, but there's also West Nile, Japanese encephalitis, and even California encephalitis. These things go on and on. The CDC has a very good page about this where they list them. And of course, if you want tips and tricks to reduce your chances of being bit by a mosquito and possibly contracting one of these, see that video, please. We have plenty of good stuff there. But you can get a brain injury via mosquito, which leads to not just the mosquito bite, but the encephalitis, which is inflammation. That's why we have enceph right there inside the skull, and itis, which is the inflammation. So the inflammation there is the brain injury. Also, we should consider meningoencephalitis, which ties in the meninges, which causes the brain to swell, thus causing a brain injury. There's also other kinds of viral encephalitis. Think about the viruses that might be around. There is such thing as herpes virus, and there's herpes viral encephalitis. Poliomyelitis, otherwise known as polio. There is an encephalitis that is possible from polio that is very deadly. Also, zoster, think shingles, right? Zoster can produce encephalitis in severe ways. And the same thing goes with varicella, otherwise known as chickenpox. Each of these can produce, in its extreme forms, encephalitis. But although rare, they are still possible. So I'm not saying that you will get encephalitis when you get shingles or chickenpox or polio or herpes. I'm just saying it's possible and that these diagnosis codes do exist and they exist for a reason. And so when we look at viral encephalitis, just keep in mind a virus, especially a systemic one, like those listed there, um, can cause inflammation throughout the body, including the brain. And that's why we have the viral encephalitis. If mosquitoes weren't bad enough, well, we also have tick-borne encephalitis. There's a few different kinds of that out there, but it's the same thing. Mosquito bites and then transfers the viral agent into the body, thus causing inflammation, including the brain. And so, yes, you can get encephalitis from tick, although extremely rare. This might be something good to know. Might make you think twice about, might want to go outside with a little bit of bug spray, maybe some tick repellent, and maybe some good shoes and socks. Also, I know this might be an overlap between degenerative and brain injury. There is such a thing as autoimmune encephalitis, where a good example of this would be if you have a flare up and your body swells up as part of an immune reaction. Think about someone with MS or possibly multiple sclerosis, or maybe they have an autoimmune disease like Parkinson's. Maybe that causes the encephalitis, the brain swelling. And so, obviously, a lot of these would have to be diagnosed by a doctor via doing a spine tap, but um, there is such a thing as autoimmune encephalitis. And the encephalitis part is the brain injury. The autoimmune is more the degenerative, but the encephalitis part is the injury. That is the brain injury. And so let's just keep these in mind, especially if you're a brain injury case manager and you're looking at medical documentation. Keep a lookout for this word, encephalitis. But there's more. We got more to cover, so let's get into it. Let's talk encephalopathy, which is disease or malfunction of the brain. Let's take this suffix here and let's call that pathy. That's the root word for patho, or where we get the term pathological. If something's pathological, it's a disease process. And so there's multiple types, and I've talked about hypoglycemic encephalopathy, but it's mainly metabolic encephalopathy. All right, something in the metabolism of oxygens, nutrients, supplies, minerals, all of that, and fluids as well, can lead to encephalopathy, which is damage and disease or malfunction of the brain. And so I've talked in the past, in a very popular video, mind you, about hypoglycemic or low blood sugar, but also hypoxia is a type of metabolic encephalopathy. Think about someone who can't get enough air. Think about someone who has breathing problems, or maybe they are getting hypoxic because they can't get air in or out. Think about hypoxia. Ischemia is another metabolic process, especially long term, because if you have ischemia, you're not getting the blood flow, thus the brain cells are dying. Hypercapnia, another one. Hepatic, which is liver. Um, Liver is another one of those things where if it starts to go bad, it'll start to poison the body. And so hepatic encephalopathy is out there. Not a very common thing. However, if the liver's failing, it's not failing. If the liver is failing, it's failing to not only digest, but also to remove some of the toxins in the body. And so we need to keep in mind that it's not just the brain we need to be worried about, it's everything else as well. Uremic is another one of those where if your kidneys aren't working, or maybe you're not able to void all the waste product out of your body via way of micturition or urination, you might see in extreme cases, someone might have uremic encephalopathy, or if they're on dialysis, they might have dialysis uremic encephalopathy. It's mainly about what's in the bloodstream at the time. And so we do see that that is possible, as well as anoxic, which kind of ties in with hypoxic. Again, oxygen exchange with carbon dioxide is a part of a metabolic process. So that's why it's considered a metabolic encephalopathy. But moving on, we also have septic encephalopathy, which, if you've heard of the term sepsis, septic, that's all pertaining to a systemic infection. And so we can see that the infection can get into the brain. Again, sepsis is a very serious thing. We also have what's called hypertensive encephalopathy. Think about the blood pressure. In this case, the blood pressure goes so high that it's not actually delivering oxygen to the brain, where the blood is just passing through. And that is a really interesting subject. Let me know if you want a deeper dive into that subject. There's also toxic encephalopathy. Think about the environment you're in. There might be, in fact, some toxins in the area that you work. Think about those toxic work environments. not where people are just yelling and screaming at you, but think about someone who deals with waste product or has to deal with hazardous material. Again, enough of that can get into the bloodstream to cause brain damage. That is a brain injury, but there's also many more. I could not fit any more on this page. There's a lot of different encephalopathy processes out there and diagnosis codes. And so fitting them all in one slide is just too hard. But just know that when you see the word encephalopathy, think brain injury, think a disease or malfunction of the brain. And that is a very wide encompassing term. But moving on, we also have one more term we need to talk about, or one more set of terms. And we've heard about mild cognitive impairment. Now, again, mild cognitive impairment, or MCI, due to a brain injury. I'm not talking in this case, we are not discussing mild cognitive impairment due to dementia, Alzheimer's, Lewy body dementia. That's not what we're talking about. We're talking about other processes that cause that mild cognitive impairment. This was brought up by the executive director. Credit to her. She got me thinking about this, and so I thought, okay, what could be a brain injury that is listed as a mild cognitive impairment? And when you see mild cognitive impairment, it should have a reason for the mild cognitive impairment. So, AIDS and HIV being it's a virus, it can deteriorate the brain. So obviously that is one of the ways that it is a legitimate diagnosis code too. We'll also see MCI due to exposure to tobacco smoke. All right, if smoking has a lot of harmful chemicals in it. I do not recommend people smoke because of the harmful chemicals in it. That is a diagnosis code. We can also see this by hypertension. So a really high blood pressure can cause mild cognitive impairment. Probably one of the more common ones we'll see when it comes to MCI is hemorrhage or infarction or cerebrovascular disease. Both kind of tie in with each other. A cerebrovascular disease, think about the injury to the vascular system. Hemorrhage, think about bleeding or leaking from the um, vascular system. And then we have infarction, which is the death of the tissues around due to lack of oxygen, so hypoxia, anoxia. And so that's why those are very serious, and that can cause a mild cognitive impairment. Um, some cases, it's more than dementia, where it's actually a brain injury. And so, other ways that you can get the diagnosis code of mild cognitive impairment could be an intracranial injury. That could possibly include a tumor, pressure, encephalitis, encephalopathy. That's a very general term inside the cranium. That is very general. But when you see an intracranial injury, that's brain injury, not dementia. So, occupational exposure, think about those hazmat people again. Think about people who are around a lot of blows to the head or around a toxic chemicals who work around all these things. And so what we see is that, yes, there is a diagnosis code for mild cognitive impairment due to occupational exposure. When you think about their occupational exposure, you might be thinking, that's probably an injury. It's not degenerative, or it could be, but it's not induced by birth trauma. It's not hereditary. So occupational exposure can cause an injury. Think about those mechanic shops that have cars running in closed and confined spaces for a long time. Carbon monoxide could be one of those. It could be one of the occupational exposures that leads to MCI. But there's also other environmental factors that could cause a mild cognitive impairment. In an otherwise perfect world, we would not have a brain injury, because brain injury happens in an imperfect world. Think about the other factors that might cause a brain injury. Think about heat stroke, think about repeated heat stroke, think about repeated, cold injuries. Think about what other environmental factors can cause mild cognitive impairment. It could be, toxic exposure. It could be, living environment. It could be a high altitude, not enough oxygen into the system, especially if they've already got a breathing problem. And so you got to think clinically, what is actually causing the damage? And so when you see mild cognitive impairment, it should say due to any one of these or dementia and Alzheimer's. So that should give you a little idea that sometimes when you see mild cognitive impairment, it's not necessarily dementia. But moving on, what does this leave me as the brain injury case manager to conclude? Well, the big thing here is that information and proper diagnosis is essential. So if I'm helping someone at a doctor's office, or I'm helping someone who is, going to a therapy, or, creating a list of medical diagnoses, the more detailed, the better. Because mild cognitive impairment does not necessarily say a cause. Encephalitis doesn't tell me what caused it. Was it a mosquito? Was it a tick bite? Was it a virus? Encephalopathy, what happened? Was it chronic traumatic encephalopathy? Was it hypoglycemic encephalopathy? Who knows? But that's why proper diagnosis is very important. We want to know and be able to say, yes, this is what the cause of the brain injury is. Also, the details within a diagnosis helps. Think about a brain injury case manager who's meeting someone for the first time and trying to find out whether they had a brain injury or not. And maybe you're talking about it and says, well, I once had this condition. I don't know how to pronounce it, but it looks like encephalopathy. Again, the details matter. Think about encephalitis. Think about mild cognitive impairment due to cerebrovascular disease. Think about those things. Also, as a brain injury case manager, or if you're a clinician, or maybe you're someone interested in brain injury, we should continue to learn about brain injury and diagnosis codes. We want to know these things. Knowing about ICD-10 codes is really helpful to a brain injury case manager, especially if you're going to be working with someone with a medical history. Being able to expand and talk about these different kind of brain injuries and explain how it happened and what we could do about it really stems from knowing the baseline knowledge. So again, knowing the diagnosis code and what it actually means. So that means that you need a knowledge in anatomy and physiology. But more importantly, we need to expand the base of knowledge, not just for us in the brain injury world, but for everybody. That's why I think sharing this video would be a great idea, especially for someone who is either a nurse or maybe going into the medical field, maybe they're a doctor. Um, you want to expand the base of knowledge. That way, the more knowledge that is out there, the better. So that way, we're not getting diagnosis of just traumatic brain injury. Maybe we're getting mild cognitive impairment because of a traumatic brain injury past, or maybe we're getting more details that help not only case managers, but also clinicians, also support personnel, or maybe their family understand what is actually going on. And so knowing and understanding makes a lot of sense in this context. But I think I will conclude it there. We should continue to learn. Here are my many references in this video. Of course, I would put those in the sources down below. I encourage people to look those up. They're always good information. We'd appreciate your feedback, especially in the form of subscribing to the channel. Maybe give us a like. We do appreciate it when we get a thumbs up. And also leave a comment. Maybe there's a lesser known brain injury I missed. I'd love to hear about it in the comments section. But until then, I hope everyone has a wonderful day. Don't forget out there, protect those brains.